on to the objective tests. These are the most important tests. So first of all, you can remember the names of the objective tests by this mnemonic, which is the dots, bags. All right. Now by D, what we have is dark field phase microscopy. Then by second, organoleptic measurement. By T, we have tongue coating index. By S, we have sulfide monitoring. By B, very important, Bana test. By E, we have the electronic test or electronic nose test. By G, very important, gas chromatography. And by S, we have saliva incubation test. Now, the gold standard for evaluating or detecting or assessing halitosis is organoleptic measurement. So, gold standard. Then, gas chromatography. All right. Now, coming on to the organoleptic. In this, what we do is this is the gold standard or the benchmark for the oral malodor measurement. In this, we have trained professionals who sniff the odor and then rate it according to the score table. All right. Now, there is a score table which has around 5 components. So, suppose this is the score table, this is the score, this is the category, and this is the description. All right. Now 0, 1, 2, 3, 4, and 5. Now 0 is when there is absence of halitosis, no detection of any odor. Second, first, if there is questionable halitosis. What does that mean is that there is some detectable odor, but however, we cannot recognize the odor. That is the examiner, he cannot recognize odor as halitosis. All right. Then second one is questionable halitosis is done. So slight halitosis. Now in slight halitosis, the examiner is able to detect odor and he is also able to recognize it as halitosis. All right. But it is within or more than the threshold. Now, third one is important. It is moderate halitosis. Halitosis definitely detected. Then strong halitosis. And fifth one is severe halitosis. Now, how are they different? Strong halitosis, it can be tolerated by the examiner. Whereas severe halitosis cannot be tolerated, and it is so intense that the examiner instructively averts his nose away from the sample. All right. Now, we are done with the organoleptic. Now, coming on to the sulfide monitoring. In this, we basically monitor the concentration of H2S, methyl carpap, methyl carp, carp, oh god, methyl mercaptan, yeah, and also of the dimethyl sulfide. All right, dimethyl sulfide, yeah. All right, the concentrations, and then we do not very important point, we do not discriminate between them. All right, then gas chromatography. In this, what we do is there is a apparatus and it is having a flame photometric system. Now it is going to measure both three of the volatile sulfur compounds, and it is basically the samples are air, saliva, crevicular fluid, and so on. Then halometers. Halometers, they measure the level of the sulfur gas and present in the person's breath. Now very important is the Bana test. Now in Bana test, first of all you must know the, I'll just write it here to save the piece of paper. Yeah. So Bana test. You must know the full form of Bana. So it stands for N-benzoyl, DL, arginine, 2-naphthyl amide. Now what we do is in this we take patient's saliva sample. Okay. Now after taking patient's saliva sample, there are going to be bacteria. I forgot to mention. There are going to be bacteria like P. denticola, T. denticola, then Porphyromonas gingivalis, then Bacterius forsythis. Now these are going to release the enzymes to break, release enzyme to break BANA, which will cause color change, which means it is a positive test. Okay, now I'll make you understand easier way. See, we will use a compound called as BANA. Now, if the patient's saliva sample has these bacteria, then these bacteria will work with their enzymes to break down this compound, and then they will cause the color change. But suppose if a person does not have these bacteria, so no breakage of the compound will occur, and then it means that there will be no color change. So it means that there will be negative test. So it means that the person does not have halitosis. All right. Now there is one more which I mentioned. First one, dark field phase microscopy. In this, we use a mercury compound, and then we see through fluorescence whether they're present or not, because at very low levels also it is highly sensitive. Then saliva incubation test. We basically incubate it in an anaerobic chamber at 37 degrees Celsius for in 80% saliva incubation. In 80% nitrogen, 10% carbon dioxide, and 10% H2 hydrogen for 3 hours at 37 degrees Celsius. And then we see through the microscope that what all organisms are present. Alright, now tongue coating index, very important. In this, basically, you have 0, 1, 2, 3. Now, in tongue coating index, it was given by Miyazaki et al. Alright, Miyazaki et al. You have 0, 1, 2, and 3. Now, non visible. In one, what you have is less than one third of the tongue. Dorsum is covered. Over here, one third to two third, and then third may more than two third. All right. Now, preventive measures. In preventive measures, basically you will have to visit the dentist, and there should be periodic tooth cleaning and brushing of the teeth, maintenance of proper hygiene, flossing. Then limit the intake of the strong foods, the odor foods. Then sugar and caffeine should be limited. Then plenty of liquid should be eaten. All right. Now, chewing gum free of all right. Now you can also chew chewing gum which is sugar free for a minute when the mouth feels dry. All right. Now in management, this is important. First of all, we try to manage halitosis through mechanical means. Now what do I mean? We all know about them. These are the tongue cleaning aids. Toothbrush, interdental cleaning, professional periodontal therapy, scaling and root planning, alright, planing, then chewing gum. Then second is chemical method. Now in chemical method, we will use chlorhexidine mouthwash. We can use essential oils, chlorine dioxide. This is very important. Two-phase oil, water, rinse. Then triclosan, amine fluoride, or stannous fluoride. Hydrogen peroxide and oxidative lozenges. Alright, now further in two-phase essential oils. What do I mean by that? In two-phase essential oils, basically what we refer to is as something with the brand name Halita trademark. Alright, in this what we see is there is 0.05% of chlorohexidine, then there is 0.05% of, very important, cetyl pyridinium chloride, and 0.14% of zinc lactate, no alcohol. Now, basically, what this does is it converts the volatile sulfur compounds. Because it has zinc, the zinc ions they bond twice negatively charged particles, that is the sulfur radicals, and they decrease the expression of volatile sulfur compounds. So it has an antimicrobial action. Alright, now third modality of treatment, which is basically this only. In this what we are doing is we are conversion of volatile sulfur compounds by use of salts. All right. Then other salts which can be used is metal salt solution, toothpaste. Then fourth is masking the malodor. Masking the malodor. In this, basically, we have mouth sprays, rinses. All right. Then last one is the use of a confidant. Now, use of confidant. Confidant is basically a person who you trust. So, to assess the effectiveness of the prescribed therapy, we use a confidant. So, this completes the lecture on halitosis. I hope I made it clear for you to understand. If you found this video helpful, do subscribe to my channel. Thanks for watching.